The AI doctor will see you eventually. So there was some research that was basically done, and The Economist wrote an article about how AI is actually doing better diagnosis of any kind of sickness in patients, and how AI can basically be used to faster drug discovery, greater efficiency, and just generating some sort of, buzz how the healthcare system can potentially be transformational. And in Europe, they also say, because in Europe there's a huge gap of the medical workers, so there's some analysts that predict that deploying the AI could save hundreds of thousands of lives each year. There is already some sort of evidence that the AI systems can enhance the diagnostic accuracy of disease tracking, improve prediction of patient outcomes, and suggest better treatments. Imagine you have some sort of mechanism, some sort of scanner that you carry with you that has AI capabilities. You stack it in, or start measuring something in a patient, and right away, based on all the data that it has collected, can interpret what is wrong with that person, because there's obviously no human error in it. So basically, the good reason that the healthcare demands are high, and evidently barriers for introducing such new tools to protect the patient safety is very important. The bad reason is data regulation. Again, TikTok is being banned in US, AI rules and legislations on the European Union are being rolled out and controlled and have to be marked, and now I imagine that once we get into the healthcare, and all the healthcare is going to be, all the data of all the patients is collected, in the Netherlands, everything's collected into like one database, I guess, because you put your personal number, so your personal ID, and then what happens, every doctor sees who you are, what insurance you have, where do you live, maybe your bank account. So I imagine that having that AI data as well, kind of integrate into all of it, again, raises a lot of security questions that, people want answers. So that's European Union and that's USA. The gap is big. However, if we look at, the gap is everywhere in the world, is quite large when it comes to medical workers and doctors and so on. So the poor countries with less developed health infrastructure have much to gain from the introducing tools like that, such as an AI-powered portable ultrasound device, for example, that can scan things, so it's going to become faster and easier. One thing that we have to think about is that institutions, I think everywhere, this technology is going to be produced, as well as in the US, where understaffed medical work, as well as in Europe. What's going to happen? We have to think of the incentive. So why would they do that? So AI promises, to cut medical costs, assisting, replacing workers, improving productivity, reducing errors, and flattening the reducing spending of for all the employees. That is desperately needed. The world would lack, I think right now they say that by 2030, 10 million healthcare workers will be, not enough for the whole world. And administration accounted for 30% of America's excessive healthcare costs compared to other countries in 2022. What does that mean? So the companies will start producing, let's say, AI medical technology or medical equipment that is going to be powered by AI, with an incentive, of course, to make money. However, a lot of countries, they make money because you get basically more visits that are unsolved by the patients, and actually that makes the money. But if the amount of people that are going to come in and actually get their stuff solved more efficiently, faster, a lot of companies, or let's say governmental institutions like government healthcare or public healthcare, or in comparison to personal healthcare, will not want that, because people would get their health solved, like let's say healed or basically recovered, and no one wants that, because that's not what generates money. Of course, it's great for the AI, for gathering data and information from the patients and understanding, and we're kind of reaching again the moment where the technology or technological progresses can be a little bit dystopian and counterproductive in this case, because the incentive of releasing such mechanism, obviously you think, tech is great, more people are gonna get the treatment they need identified faster in countries that are underdeveloped, we're understaffed. Great, solves a lot of issues, but again, if we think long term, is it actually solving anything? So let's think about it.